Familial Hypocalciuric Hypercalcemia, abbreviated FHH, is a rare inherited condition where the blood calcium level is a little higher than normal, but the kidneys do not throw away much calcium in the urine. Think of it like a house where the thermostat, calcium level, is set a bit too high, yet the doors, kidneys stay closed and keep the heat inside. FHH is caused by a change mutation in the calcium sensing receptor, gene CASR, that tells the body how much calcium is present. The mutation is usually passed down from just one parent autosomal dominant. Some families may have similar changes in nearby genes, like GNA11. It works like a broken ruler. The body thinks it has low calcium even when it does not, so it does not let the kidneys dump excess calcium. Most people with FHH feel fine and have no obvious problems. When symptoms appear, they are usually mild, such as a little tiredness, weak bones, or very rare kidney stones. Because the calcium rise is gentle, you often hear doctors say, "It's a silent condition." Doctors check a simple blood test, high calcium and a normal or slightly high parathyroid hormone, PTH. Then they measure calcium in a spot urine sample. It will be low, which is the opposite of other high calcium diseases. A genetic test confirming a CASR mutation seals the diagnosis. Unlike primary hyperparathyroidism, FHH does not need surgery. Most patients are just monitored and told to stay hydrated. If calcium gets too high, doctors may consider medicines that mimic the calcium sensor, calcimimetics, but this is rare. Because FHH is inherited, you cannot prevent the gene from being passed on. However, families can do 3 things. Test close relatives early to know who has the mutation. Get genetic counseling before having children. Avoid unnecessary surgeries by sharing the diagnosis with any doctor who orders calcium tests. Think of it as sharing a family recipe, so the next cook knows what ingredients to expect. New research is using advanced DNA sequencing to find even tiny changes in the CASR pathway, which helps doctors diagnose FHH faster. Scientists are also testing new calcimimetic drugs that may lower calcium without surgery. Some labs are exploring gene editing tools like CRISPR as a long-term possibility, but that is still experimental. These advances mean that in the future, people with FHH might have more personalized treatment options.